Part 2, Section 3. Can we prevent or even reverse chronic diseases? Make your cells respond to insulin again. Friends, next is the second pillar that can change the course of chronic disease. In the previous section, we discussed how controlling glucose spikes by slowing absorption can reduce metabolic stress. That was the first pillar. But even if glucose enters the bloodstream slowly, the body must still use that glucose effectively. This depends on how well the body responds to insulin. This brings us to the second pillar of metabolic health, improving insulin sensitivity. Insulin is the hormone that allows glucose to move from the bloodstream into the cells. When cells respond properly, glucose is used efficiently for energy. But when cells stop responding effectively, a condition called insulin resistance, glucose remains in the bloodstream, insulin levels rise, and chronic metabolic damage begins. Insulin resistance develops gradually and silently. Many people feel completely normal while it is developing. There may be no symptoms. Blood sugar may still appear within normal range. But inside the body, insulin levels are rising, inflammation is increasing, and organs are slowly being affected. This is why insulin resistance is often called a silent metabolic disturbance. Over time, insulin resistance contributes to type 2 diabetes, fatty liver, hypertension, obesity, metabolic syndrome, heart disease, stroke, kidney failure, nerve damage, eye damage, cancer development, mental health issues. The important message is this: insulin resistance can improve. Cells can become responsive again. And this can be done using simple, affordable, sustainable lifestyle measures. This lecture explains how. What is insulin sensitivity? After we eat, carbohydrates are digested into glucose. Glucose enters the bloodstream. The pancreas releases insulin. Insulin signals the cells to absorb glucose. When insulin sensitivity is good, small insulin release is enough. Cells respond quickly. Glucose enters cells easily. Blood glucose returns to normal gradually. Energy remains stable. When insulin resistance develops, cells respond poorly. More insulin is required. Glucose remains in bloodstream. Pancreas releases more insulin. Insulin remains elevated. Inflammation increases. Over time, fat storage increases. Liver produces more glucose. Pancreas becomes stressed. Beta cells weaken. Glucose rises further. This becomes a vicious cycle. Breaking this cycle requires improving insulin sensitivity. What happens inside the cell? Insulin binds to receptors on the cell surface. This activates signaling pathways. These pathways move GLUT4 transporters to the cell membrane. GLUT4 acts like a doorway, allowing glucose to enter. In insulin resistance, insulin receptor signaling weakens. GLUT4 movement decreases. Glucose cannot enter cells efficiently. Glucose accumulates in bloodstream. Improving insulin sensitivity restores this process. The metabolic master switch. AMPK is a cellular energy regulator. When activated, increases glucose uptake, improves insulin sensitivity, increases fat burning, reduces liver glucose production, improves mitochondrial function. Many natural foods activate AMPK, helping restore insulin sensitivity. Why insulin resistance is dangerous. The danger of insulin resistance is not just elevated glucose. The real danger is long-term organ damage. Kidney damage, often irreversible. High glucose damages tiny kidney blood vessels. Over time, this leads to chronic kidney disease. Early stage. No symptoms. Silent damage. Later stage. Protein in urine. Swelling. Fatigue. Advanced stage. Dialysis required. Lifelong treatment. Dialysis, several hours each session. Multiple times weekly. Physically exhausting. Financially expensive. Some patients require kidney transplantation. Even after transplant, lifelong medication is required. Many families experience this hardship. Prevention is far easier. Stroke. Sudden and life-changing. Insulin resistance increases risk of stroke. Stroke may cause paralysis, inability to walk, loss of speech, swallowing difficulty, memory loss. Some patients never recover fully. Families must provide long-term care. This is one of the most devastating complications. Eye damage, vision loss. High glucose damages retinal blood vessels. This leads to blurred vision, bleeding, retinal damage, vision loss. Advanced damage may not be reversible. Protecting insulin sensitivity protects vision. Nerve damage. Insulin resistance damages nerves. Symptoms: numbness, tingling, burning, loss of sensation. Loss of sensation increases risk of foot ulcers. Severe cases: infection, amputation. These complications are preventable. Many people around us are affected. We see dialysis patients, stroke survivors, heart attack, cancer, individuals with vision loss, lifelong disability, etc. These are not rare. Many of these begin with insulin resistance. This knowledge helps prevent progression. Natural ways to improve insulin sensitivity. These approaches are simple and accessible. Bitter melon improves glucose uptake, activates AMPK, improves insulin sensitivity. Cinnamon improves insulin receptor signaling, increases GLUT4 activity. Ginger improves cellular glucose uptake, reduces inflammation. Turmeric plus black pepper reduces inflammation, activates AMPK. Olive oil improves insulin sensitivity, reduces inflammation. Vinegar improves glucose uptake, improves insulin sensitivity. These are simple, home-based approaches. Fenugreek, methi, improves insulin sensitivity mainly through its soluble fiber, galactomannan, which slows glucose absorption and reduces the need for large insulin release after meals. It also contains 4-hydroxyisoleucine, an amino acid that enhances insulin signaling and helps muscle and liver cells respond more effectively to insulin. Simple daily routine. Morning: bitter melon or ginger, turmeric plus black pepper. Before meals: vinegar. With meals: olive oil. Evening: cinnamon. This routine is sustainable. Sustainability and commitment. These foods are low cost, easily available, simple to prepare, sustainable long-term. Consistency matters. Small daily actions create long-term benefits. The hidden cost of insulin resistance: financial, physical, and emotional. One of the most important reasons to understand insulin resistance is not just the medical consequences, but the real-life burden that follows when complications develop. Chronic diseases do not only affect the individual, they affect the entire family. Consider chronic kidney disease. In early stages, there may be no symptoms. But once kidney function declines significantly, treatment becomes complex. Dialysis may be required multiple times per week. Each session may last several hours. Patients often experience fatigue, weakness, and dietary restrictions. The cost of repeated dialysis, medications, and hospital visits becomes significant. In advanced stages, kidney transplantation may be required, which involves surgery, long-term medication, and careful monitoring. Similarly, stroke can occur suddenly. A person who was previously independent may suddenly lose the ability to walk, speak, or perform daily activities. Recovery may be partial. Some individuals remain dependent on caregivers for years. This creates emotional strain for the patient and the family. Vision loss is another devastating complication. Damage to retinal blood vessels may progress silently. By the time symptoms appear, damage may already be advanced. Treatments may slow progression, but may not fully restore vision. Losing the ability to read, drive, or recognize faces significantly affects quality of life. Nerve damage can also develop gradually. Loss of sensation in the feet may lead to unnoticed injuries. These injuries may become infected and difficult to heal. In severe cases, amputation may be required. These complications are difficult to reverse once advanced. Prevention becomes extremely important. Improving insulin sensitivity helps reduce the risk of these outcomes. How insulin sensitivity improves metabolic health. Improving insulin sensitivity produces multiple beneficial effects. Glucose enters cells more efficiently. Insulin levels decrease. Inflammation reduces. Liver produces less glucose. Fat storage decreases. Energy becomes stable. These changes improve overall metabolic balance. When insulin sensitivity improves, the pancreas does not need to release large amounts of insulin. This reduces stress on beta cells and helps preserve their function. Improved insulin sensitivity also reduces glycemic variability. Instead of large fluctuations, glucose levels remain stable. Stable glucose reduces oxidative stress and protects blood vessels. The role of inflammation in insulin resistance. Chronic, low-grade inflammation is a major contributor to insulin resistance. Inflammatory molecules interfere with insulin signaling pathways. This reduces the ability of cells to respond to insulin. Natural foods such as turmeric, ginger, and olive oil contain compounds that reduce inflammation. Reducing inflammation helps restore insulin sensitivity. Reducing inflammation also protects blood vessels, nerves, and organs. The role of the liver. The liver plays a central role in glucose regulation. In insulin resistance, the liver may continue producing glucose even when blood glucose is already elevated. This contributes to fasting glucose elevation. Improving insulin sensitivity helps regulate liver glucose production. This helps reduce fasting glucose levels. Foods such as bitter melon, vinegar, and turmeric may help reduce excessive liver glucose output. The role of muscle. Muscle tissue is a major site of glucose uptake. When insulin sensitivity improves, muscles absorb more glucose. This reduces circulating glucose. GLUT4 transporters in muscle cells increase glucose uptake. Foods that improve insulin sensitivity help activate GLUT4. Improving insulin sensitivity in muscle helps maintain stable glucose levels. The role of fat tissue. In insulin resistance, fat tissue releases inflammatory molecules. These molecules worsen insulin resistance. Improving insulin sensitivity reduces inflammation from fat tissue. This improves metabolic balance. Practical daily routine for improving insulin sensitivity. Morning. Ginger or bitter melon. Turmeric plus black pepper. Before meals, diluted vinegar. With meals, olive oil. Vegetables first. Evening, cinnamon. This routine combines multiple mechanisms, improves insulin signaling, reduces inflammation, activates AMPK, improves glucose uptake. These steps are simple and sustainable. Commitment and long-term benefits. Improving insulin sensitivity leads to better glucose control, reduced insulin levels, improved energy, reduced inflammation, reduced risk of complications. Small daily actions create significant long-term benefits. Why early action matters more than late treatment. One of the most important messages in understanding insulin resistance is this: early correction is simple, late treatment is difficult. When insulin resistance begins, there are usually no symptoms. Glucose may still be within acceptable limits. Many people feel completely normal. But internally, insulin levels are rising, inflammation is increasing, and organs are gradually being affected. If action is taken at this stage, improvement is often achievable with simple lifestyle measures. However, if insulin resistance continues for years, structural damage may develop in organs such as kidneys, eyes, nerves, and blood vessels. Once this structural damage occurs, reversing it becomes difficult or sometimes impossible. This is why prevention is far easier than treatment. A person who improves insulin sensitivity early may avoid years of medication, hospital visits, and complications. A person who waits until advanced disease develops may require complex treatment. The economic burden of chronic disease. Chronic diseases also carry significant financial implications. Long-term medication, regular investigations, specialist consultations, and hospital visits create ongoing costs. If complications develop, the expenses increase further. For example, dialysis requires repeated hospital visits. Stroke rehabilitation may require physiotherapy. Eye procedures may require repeated treatments. Nerve damage may require long-term care. These expenses accumulate over time. In addition to financial cost, there is also loss of productivity, reduced independence, and emotional stress. In contrast, preventive strategies often involve simple dietary changes and lifestyle measures that are inexpensive and sustainable. This highlights the value of prevention. The role of consistency. Improving insulin sensitivity is not achieved by a single action. It requires consistent daily practice. Small improvements accumulate over time. Gradual changes in insulin sensitivity lead to better glucose control and reduced inflammation. Consistency is more important than intensity. Even modest changes practiced regularly can produce meaningful results. This approach is practical because it does not require drastic measures. For example, small dietary adjustments, simple daily routines, mindful meal timing, consistent use of natural foods. These steps are manageable and sustainable. How these strategies work together. Each natural strategy targets a different mechanism. Bitter melon improves glucose uptake. Cinnamon enhances insulin signaling. Ginger reduces inflammation. Turmeric activates AMPK. Vinegar improves insulin sensitivity. Olive oil improves metabolic flexibility. When combined, these effects complement each other. Together, they improve insulin sensitivity more effectively than any single measure alone. This combined approach is practical and accessible. Long-term benefits of improved insulin sensitivity. Improving insulin sensitivity produces multiple long-term benefits: reduced glucose variability, lower insulin levels, reduced inflammation, improved vascular health, improved energy levels, reduced risk of complications. Over time, these changes support overall health and well-being. The importance of sustainable habits. Sustainable habits are essential for long-term success. Extreme measures are difficult to maintain. Simple daily routines are more practical. Sustainable habits include consistent meal patterns, natural food choices, gradual improvements, regular monitoring. These habits support long-term metabolic health. Therefore, improving insulin sensitivity is not complicated. It involves simple, consistent steps. These steps are accessible, affordable, and sustainable. They aim to restore the body's natural ability to regulate glucose. By improving insulin sensitivity, glucose control improves, insulin levels decrease, inflammation reduces, organ protection improves. This knowledge empowers individuals to take proactive steps toward better health. Early action, consistency, and commitment are key. Disclaimer: this lecture is for educational purposes. Individuals with diabetes or other medical conditions should work closely with their treating physician when implementing these strategies. Monitoring glucose levels is recommended, as medication adjustments may be required. Holistic Wellness Foundation, IMFAL.